So the disorder I'm going to be talking about is Alzheimer's. Alzheimer's is a disease that causes loss of brain function and usually affects people who are 65 and older. It's very rare in younger people, but very common in older people. It was discovered by Alois Alzheimer, hence the name Alzheimer's. When he discovered it, he thought it was pretty rare, but now Alzheimer's is known to be the most common cause of loss of brain function in people over 65. 5% of people who are 65 to 69 have Alzheimer's, and 15% of people 70 to 84 have it, and 40% of people 80 and above have it. What causes Alzheimer is the overexpression of the gene presenilin-2 in nerve growth with increased apoptosis and the production or deposition of the beta protein in the brain. And this is a loss of function mutation. Inheritance is it's autosomal dominant, so you can get it if one affected parent has it, and you can test for this PSEN1 mutation prenatally, but this is really uncommon because this is a disordered disease that doesn't affect you until later in life most times, so it's safe to wait and test for it until the baby is born or even older. And if you carry one of the mutations or even two, it still doesn't mean you would get it. And like as shown in this picture, it shows you kind of how the possibilities of inheriting Alzheimer's from your parents is. This case study discusses the ways of diagnosing Alzheimer's and ways to follow up with it because as of now, there's no good way of diagnosing Alzheimer's or determining the stages of it. This case study was carried out by Serge Gauthier and studies the earlier markers and ways to follow up. The case that we'll be talking about is over a 69-year-old Caucasian woman. And to test, he had them draw clocks and used MMSEs, which is mini mental status exams, and used stages of deteriorations as shown in this picture right here. At the beginning of the case study, she was having small amounts of forgetfulness, such as forgetting her keys or forgetting what day of the week it is, and small stuff like that. And she could draw a perfect clock and had mild limopraxia, which is like having small issues with using her arms or hands in like functional ways that would just be normally used in everyday life. And her MMSE score is 27 out of 30, which is normal, and she was not diagnosed with Alzheimer's at this time. 20 months later, her memory impairment has worsened. She's nervous and anxious, and she says that her memory is embarrassing her now, and she stopped working in an office and has limopraxia, and her clock drawing is impaired. An early Alzheimer's diagnosis is made. And here is actually a picture from the study showing clock drawings at different MMSE scores, and it just shows how they slowly get worse. And 1 year later, she had word-finding difficulty and needs supervision cooking, sad and sleeps during the day, but depression was ruled out, so it wasn't due to that. And her MMSE is 24 out of 30, which shows her score slowly decreasing, and her clock drawing was more impaired. A year after that, she stopped cooking completely. She needs help picking clothes and forgets to get phone messages and has more anxiety. She can still be left alone for a few hours at a time while her husband attends the golf club, but her MMSE is 20 out of 30 and still decreasing. And this shows some of the stages of Alzheimer's and how long it usually takes to get there and how it affects the brain. And for diagnosis of Alzheimer's, as the case study talked about, there's no exact way to diagnose it, and for now they're just using memory impairment tests and other thinking skills to see how far they think it's progressed. They also test behavior changes such as becoming more anxious or nervous. You cannot tell for sure if someone has Alzheimer's until they've died, and you can study the brain closely under a microscope. The mutation is very uncommon, can be tested for prenatally, but that's uncommon as I talked about earlier because it usually doesn't affect people till they're older. And in this picture, it shows a healthy brain and a severe Alzheimer's brain, and it shows like the deterioration of the brain. The treatment for Alzheimer's is usually medication that can help with cognitive and behavioral symptoms. Some of the behavioral symptoms are anxiety and nervousness, so some anxiety medication can help or something to help with cognitive issues, but right now there's no cure for Alzheimer's. These just help with dealing with it. And this is the evolution of the gene. You can see how it progressed over time.